Intentional hourly rounding and improved patient care. Evidence-based practice presentation by Mary E. Lehman for IPC 401 Research in Healthcare. Intentional hourly rounding includes addressing a patient's pain, environment, elimination or toileting, and positioning, and is also known as PEEP. Intentional rounding has become an expectation and requirement of hospital staff at hospitals founded on evidence-based practice. Standard care, which is described as checking on a patient every hour but not intentionally addressing PEEP, does not meet the expectation of intentional hourly rounding. Merely performing standard care is not sufficient to assess medical status, address needs, or prevent adverse events. East et al. Contend that intentional hourly rounding provides an opportunity for nurses to regularly attend to patients' needs, which is central to patient care. The rationale for this presentation is that PEEP is not performed with each intentional hourly rounding on the unit that I work, per the expectation. On the unit that I work, there's an electronic system that alerts staff that hourly rounding is due. Staff must enter the patient's room at this time and push a button that electronically documents that hourly rounding has been performed. It's easy to enter the patient's room, push the button, and maybe even look at the patient, but that's not truly meeting the expectation of performing intentional hourly rounding with the components of PEEP. The purpose of this presentation is to review the literature and determine if performing intentional hourly rounding with the components of PEEP does promote improved patient care. The research or PICO question for this presentation is: how does intentional hourly rounding, addressing patient pain, environment, elimination, and positioning, also known as PEEP, compared to standard care, promote improved patient care? Adult med-surg patients are the population. Intentional hourly rounding addressing pain, environment, elimination, and positioning, or PEEP, is the intervention. Standard care is the comparison, and improved patient care, or the promotion of improved patient care, is the outcome. For this presentation, and as part of this course, 5 relevant peer-reviewed primary research studies, less than 5 years old, that were related to the problem have been reviewed. The search strategy for this presentation included the use of PA College's Summon Discover tool to search multiple databases. PubMed and CINAHL were also searched. Subject headings included intentional, hourly, rounding, nurse, patient, hospital, surveillance, falls, patient satisfaction, and nursing staff. The rationale for the articles that were chosen were based on their relevance to the subject being researched, and they were chosen to thoroughly examine the subject critically from varying viewpoints and perspectives. The articles that were chosen were from the perspective of nurses, patients, family members, student nurses, and also were chosen because of their opposing and varying viewpoints. The articles were determined to be relevant research studies by identifying the method and design of the study. Only original research was included. Quality improvement, evidence-based practice studies, or literature reviews were excluded. Locating primary research articles was definitely easier than it had been prior to taking IPC 401, but still presented challenges in determining that the articles were in fact primary research. Being able to identify the components of primary research definitely became easier as the course progressed. Utilizing library librarian and instructor feedback regarding if the articles were primary research or not was extremely helpful. East et al. Found that staff understanding and practices are key to intentional rounding success. They also found that through intentional rounding, regular care and comfort can be provided when needed, and this increases patient satisfaction with care. East et al. Further believe that intentional rounding allows nurses to practice anticipatory care versus reactionary care, while Ryan et al. Found that negative perceptions towards intentional rounding mostly stem from lack of understanding about its purpose and the additional documentation and interruptions that intentional rounding creates to the daily workflow. Organizational level, along with social and political tensions, were determined by Pete et al. To impact patient care and create misunderstandings surrounding intentional hourly rounding as a discrete, isolated activity. It was a common theme amongst authors of several articles that mentioned the importance of proper education and understanding of intentional rounding practices as key to successful implementation and nursing staff acceptance. Ryan et al. Mentioned education as especially important for nursing students as the future of nursing. In regards to fall prevention, Morgan et al. Offered intentional rounding as a method for monitoring how frequently a patient has been assessed. Frequent assessments have been shown to lead to a reduction in falls and improve patient care. Intentional rounding has been described as systematic and based on strategy. Morgan et al. Prescribe a high level of adherence to the process of intentional rounding as contributing to its overall effectiveness and improved patient care. Sims et al. Offered a negative perspective of intentional rounding and found it to be merely a form of documentation for nurses, whether care had been provided or not. They also did not find intentional rounding to promote an increased level of patient care, but actually found it to reduce it to a minimal standard. The approach I took when synthesizing the literature was based on recommendations offered as part of this course. I read over the articles multiple times and determined what the main points and themes were. And then I tried to critically evaluate the information to form my practice recommendation based on the problem that I had chosen. The practice recommendation for the problem of intentional hourly rounding not being performed as expected is based on the literature and would be to perform intentional rounding each hour, addressing PEEP, pain, elimination, environment, and positioning, as per the current expectation. This practice recommendation is based on the following three main ideas from the literature. Improved patient care, interactions, satisfaction, and outcomes can be achieved through intentional rounding practices. East et al. Staff adherence of intentional rounding practices leads to its effectiveness. Morgan et al. An education on and the purpose of intentional rounding needs to be provided to nursing staff and clearly understood to promote success. Ryan et al. Since this recommendation is the current practice on the unit that I work, there would be no additional implementation necessary. There would, however, need to be additional time spent on re-education about the current practice and evaluation of adherence by staff in performing intentional hourly rounding as expected. Potential issues include the time spent on re-education and staff adherence and compliance with the current recommendation. I like this picture because I think it embodies intentional rounding. It shows engagement by the nurse with her patient, and it also shows the positive impact of intentional rounding on the patient as patient satisfaction with the care that they are receiving. So in conclusion, intentional rounding has potential to be a powerful tool in the practice of excellent patient care. Excellent patient care requires routine assessment and surveillance of patients. Without adherence to the components of intentional rounding, it becomes another task or form of protective nursing documentation without benefit to the patient or the nurse. When patient care is performed at the highest level and supported at the organizational level, patient and nurse satisfaction will be mutually achieved. Understanding and education of intentional rounding is a requirement before it can be performed effectively. Intentional rounding, addressing PEEP, pain, elimination, environment, and positioning, is an effective tool to achieve the level of patient care that all patients deserve.